Tay-Sachs disease. Treatment of disease. Ana Camila Sertuche. Is there therapy available? There is no treatment available as of right now. Anticonvulsant medicine may initially control seizures. Other supportive treatment includes proper nutrition and hydration, and techniques to keep the airway open. Children may need a feeding tube. Parent group and disorder. Tay-Sachs is a disease that runs in the family. A child can inherit it from both parents. This disease is inherited in the following patterns. Autosomal recessive inheritance. Autosomal means the gene is located on any chromosome except the G or Y chromosome. Sex chromosomes. Gene-side chromosomes usually come in pairs. Recessive means that both copies of the responsible gene must have a disease-causing change. Pathogenic variant. In order for a person to have the disease. Mutation is an older term that is still sometimes used to mean pathogenic variant. Genetic testing. Although Tay-Sachs mutations are rare in the general population, non-Jewish individuals may be screened as spouses of Jewish carriers or as relatives of Provence. DNA screening can be best used as an adjunct to enzyme testing to exclude known hexapseudodeficiency alleles, the IVS9 1GA disease allele, and other mutations relevant to the subject's genetic heritage. Screening. The son of an Ashkenazi couple was entirely normal until age 16, when slight leg muscle cramps began. Hex-A deficiency was found in a screening program at age 20. Both parents and a sister were heterozygotes. Heterokaryon complementation showed the development of Hex-A when the Provence cells were fused with Sandhoff cells, but showed no complementation with Tay-Sachs cells. Trix-Rain compared DNA-based and enzyme-based screening tests for carriers of TSD among Ashkenazi. No treatment is available for this fatal disease. However, gene therapy could represent a therapeutic approach. There has previously been constructed and characterized in vitro adenoviral and retroviral vectors coding for alpha and beta subunits of the human beta hexosaminidase. Only the supply of both subunits allowed for hexa overexpression, leading to massive secretion of the enzyme in serum and full or partial enzymatic activity restoration in all peripheral tissues tested. These results confirm that the liver was the preferential target organ to deliver a large amount of secreted proteins. CRISPR. CRISPR has also demonstrated its genome editing efficacy in the mouse models of Tay-Sachs and Sandhoff diseases. Mutations in hexa, which encodes the Hex-A subunit, lead to Tay-Sachs disease, while mutations in Hex-B, which encodes the Hex-B subunit, cause Sandhoff disease. Thank you.
Tay-Sachs disease, signs and symptoms. Function of organelle. The function of organelle is the lack of enzyme that aids in the breakdown of fatty compounds. The disease Tay-Sachs is classified as lysosomal storage. The cells primarily digesting organelles are called lysosomes. The brain and spinal cord are unable to operate correctly because of the impaired nerve cells' lack ability to function. Function disrupted by mutation. The condition Tay-Sachs is driven by mutations in both alleles of the hexa gene of chromosome 15. The enzyme beta-hexosaminidase A is deficient as a result of the genetic mutation that causes Tay-Sachs disease. The fatty compound GM2 ganglioside must be broken down in order for this enzyme to function. The brain and spinal cord never end cells they're harmed by the accumulation of fatty substances. This diagram is an example of a child with Tay-Sachs disease and a child without Tay-Sachs disease. Medical problems. Tay-Sachs disease appear between the ages 3 and 6 months. Muscle starts to fail and development decreases as the condition gets worse. This eventually causes seizures, loss of eyesight, hearing, paralysis, and other symptoms. Other symptoms of the disease will be from the muscle weakness, coordination problems, muscle contractions, stiff muscles. For the body will be feeling faint, and other symptoms will be difficulty in speaking, difficulty swallowing, hearing loss, seizures, vision loss. Characteristics of disease will be the life expectancy for children when TSD is around 5 years old. TSD can happen between 2 and 10 years old. TSD only happens when both parents are carriers of the gene. TSD can also occur in teens and adults, causing less severe. Anyone can be a carrier of TSD, and females and males are equally affected.
History and physical findings of Tay-Sachs disease case study. Diagnosis of Tay-Sachs disease are characterized depending on the age of onset. There are several stages of onset: infantile 3 to 6 months, juvenile 2 to 5 years of age, chronic first or second decade of life, late onset would be the second or third decade of life. My patient that I reviewed was an 18-month-old male patient. This patient was born of healthy parents. They had no history of inherited metabolic or neurologic diseases. From the age of 3 months to 8 to 12 months, the patient was presented to the emergency room, and eventually the patient could not make eye contact and showed hypersensitivity to sound and startle responses. A few facts of the findings from this patient. At 18 months old is when the patient was actually diagnosed, and there was a brain MRI. I presented a photo of the brain MRI. And this is the cherry red spot that was found on the MRI. I'll go back just one slide so you could maybe get a view of that. Okay, and for families who suffer with this disease, there are nonprofit organizations, and I have listed one here that would assist.